Welcome to the EMT Pro podcast, where we deliver relevant EMS content from the field and the classroom each week. Each episode of this podcast can get you 1 full hour of CE through our partner, emt-ce.com. So head over there for more information. I'm your host, Steve Williams, and with me today, as usual, Dan and Holly. Guys, say hello.
Hi, Steve. So when you say as usual, is that a good thing, or is like you can't find anyone better?
As usual.
I think it's as like, hey, they're here, like, woo.
I do think you should be more excited about it.
Yeah, please.
Maybe
next time.
Maybe on the next one, I'll do a really like, I'll throw in some sound effects.
Or
yeah, exactly. Something.
Circus is here.
Oh goodness. We've got a totally different type of episode today. We're gonna do. I got some lung sounds. I'm gonna quiz you guys on lung sounds. And we're gonna talk about some of our more unique lung sound calls. At least I've got one. I don't know if you guys have anything, but
I went to mail order paramedic school.
Mail order.
Mail order.
Okay, mail order paramedic school.
So I'm pretty good at good breath sounds, wheezes.
Yeah,
when they're
You
just
got those down.
frothing at the mouth. Other than that, I'm not real good. So this will be.
So you're good at the ones that you really don't even need to listen to. They're just so obvious when you walk in the room.
Right?
Yeah. Okay.
I'm really good at the ones that are in the drop-down menu of our charting system that I get to choose from.
Yes.
I got those
Well
down.
played. Absolutely.
Well, I'm going to learn something.
Yeah, I hope so. I mean, we've never done anything like this before. It's kind of like a podcast quiz.
Oh, geez.
We're
Okay.
about to reveal
Yeah.
how much we don't know.
I mean, my money's on Holly, but
Of course.
There's listeners that are totally backing you right now, Daniel.
Oh, I understand that. That's
so.
We should have a contest.
Yeah, I think we should do a contest right now between the two of you.
What about you? Oh, because you can see
I
the
can
answers.
see them, and I know which ones I programmed into the.
And he's a
little
5-star
beatbox
medic.
And I got
All right,
5 stars. Yeah.
And Master Williams over there.
Yeah. Well, the way this is going to work, we're going to do a quiz, not a quiz, kind of a quiz, but it's going to be a contest.
okay.
And the winner between the two of you, I will buy coffee. And,
You'll buy coffee this time?
yeah, I'll buy coffee. You have to actually respond to my text when I offer it. And then a treat, as my daughter would call it, a treat.
I like it.
Yeah. So it could be a cake pop.
There is nothing more motivating for EMS people than food
Yeah.
Right.
and coffee.
Yeah. Like it could be a granola bar.
So, question:
You want a parfait? I'll get you a parfait.
Do you parent your kids where, okay, you're going to buy your daughter something, but you also buy your son something?
Have to.
Okay,
Yeah.
so I'm the same way. So if Holly wins, I still get something.
Well played.
This isn't,
well played.
This isn't parenting. This is adulting. Okay. So
Oh,
it's
adulting
time to,
sucks.
yeah. This isn't a participation trophy you're going to get today, Daniel.
That's how I grew up.
Man.
Why do you think I'm going to win?
You know how smart you are?
So
Smart
you went to
ass.
5-star paramedic school too.
I did.
Yeah. Which just kind of assumed that I'm the only
I
one,
am
but
sandwiched
she
in
did.
between this.
Yeah. The sandwich between greatness. Yeah. And Holly
We're just
went on to nursing school, completely continued her education and
Right.
moved up,
I topped out a long time ago.
And then BSN, correct?
mm-hmm.
CRCN? What's the critical care nursing one?
CFRN. For flight
CCRN?
nursing, it's the certified flight nurse.
Yeah.
I'm right here.
And a certified emergency
I'm staring
nurse.
right at you as
Not
we
that
go
I'm
through her
bragging.
resume.
FPC. I don't even know what that means. But,
Flight paramedic certified.
oh,
Thank you, Steve.
thank
You're
you.
welcome.
Holly's a great parent.
If I were injured, I'd want you to take care of me, Daniel.
Oh, thank you.
Yeah.
All right.
So
I'm
the
ready.
way this is going to work, there's 8 lung sounds I have for you.
There are 8 lung sounds?
Yeah.
Jeez. Okay.
Yeah.
Got to go back to my
You go to
flashcards.
3. Okay.
I mean,
I believe you.
some of them are a little finicky, but they're part of this. And what I'm going to do is give you the lung sound. We'll do the who got it right, who got it wrong. And then I'm going to read you from the book what the definition of it is. Okay.
Okay.
Because we got to do some classroom stuff on this podcast. It's good to go straight from the book
If
on
we
occasion.
bomb this, can we just delete the podcast?
Yeah. We'll just edit it out. We'll just
All right.
ignore that one. But for the record, we're going to be using the AAOS, Advanced Emergency Care and Transport of the Sick and Injured textbook on this. So I think what we're going to do is I'm going to look at you guys. Whoever raises their hand first is going to get their choice of giving the answer first. If you're wrong, it can go to the next person. If you're both wrong, well,
Steve
move on to the
gets
next
your
one.
coffee.
Yeah.
But you're going to give the answer.
Yeah. I'll give the answer every time.
All right, let's go. And Holly's not going to be wrong. So,
I'll just make something up.
yes.
Okay. Number 1. Ready? That was Dan. You can't cheat.
I'm gonna say normal lung sounds.
Okay. Do you want to be a little bit more specific?
Oh
on that?
my gosh. I raised my hand first. Did you not see that?
I did. And you were wrong.
You're
You said
wrong.
Ronchi. You got it wrong.
See how I jumped in there?
I just bypassed you. Yeah, it's not even worth discussing because it was so off.
Can we just tell the audience that we're all 3 middle children with type A personalities?
We learned that today. Yeah.
Yeah.
Isn't that crazy? All 3 middle kids.
Well, I'm
So
just going to tell
when
you.
the competition gets going, it's going to be
There'll be some wrestling.
Pretty good, yeah.
And just so you know, that audio sucks. That is not a normal breath sound. With all due respect, Lieutenant Sir.
So, hang on.
brachiovesicular breath sounds.
What are the chances, though, that you're hearing it in like a high def audio for the first time in your life and not through a stethoscope, and you're kind of like hearing a lot more detail?
Well, I've never done that. I went to mail order school.
Yeah. Well, now we're here and we're doing it.
Okay. Thank you for the education.
Yeah. Okay.
HDMI cable.
You are definitely correct, but extra credit points if you can give a further description of this specific breath sound. There's 2 types of normal breath sounds. There's
Inspiratory and expiratory? Wait.
I'm going to say
it's the structures that the air
Wrong.
moves through.
go something or other. Isn't vesicular one?
Mm-hmm.
See?
There's vesicular breath sounds, and then there's
Bronchial
yes.
breath sounds.
So okay, she's getting a point for that.
Okay, that's fine. But can I listen to it one more time just
Yeah,
so it
absolutely.
all clicks?
Yeah.
Oh, I hear it now. Absolutely.
am your father.
That's the other thing.
Darth Vader.
What does it sound like? It does kind of sound like Vader.
It does.
Kind of at the end there.
Yeah.
But it sounds like a large airway.
All right.
I see
So
that.
the textbook definition of bronchial breath sounds represents air moving in and through the bronchi. There
Excellent
you go.
definition.
Excellent definition, right?
Okay.
All right.
All right. So I'm
So
down by 1 point.
Holly has a point. Daniel has 0. Now the question is, are we going to go like Jeopardy rules where if you get one wrong, you subtract a point?
Oh my gosh.
Or should we
No?
just, no, I don't, I mean, what do you
She
think?
earned that point. You did great.
Thank you.
Nice job.
Thank you, middle child.
Okay. So, but are we going by,
Yes. So she's
Just-
ahead 1-0.
she's got 1-0.
Permanent.
Okay.
Permanent.
okay. It's like basketball. Not gonna-
I got the point.
when you miss,
can't take
you
it
don't,
away from me.
we're not taking it away. Okay.
Take it away.
Okay.
Unless it's a tie, maybe, and then we have to bet how many
It might
points.
be a tie.
It's gonna be.
All right.
Okay. Ready for the next one?
Yes.
Okay. Oh, and by the way, since there's an even number of lung sounds, I have a tiebreaker question about lung sounds in
Double Jeopardy?
general. Yeah.
Okay.
If there's a tie. At this rate, it's going to be a blowout.
We only had one question.
Right.
So.
Okay. Let's go.
Okay.
Wrong guy.
You have to raise your hand, Daniel.
Wrong guy.
Okay. Dan's got his hand raised, and he's saying wrong guy. And he's wrong.
You put the wrong and wrong guy. Well, I'm just going to take a guess. Vesicular breath sounds.
It's not vesicular breath sounds. You guys are both incorrect. Is your strategy on this just to guess wrong guy for everything?
No, I don't know what the that is.
I mean, there's no way we can discuss this anyway, keep going. Let's play it
Okay.
again.
Okay, here we go.
Rails.
It sounds a little wet.
Moist.
It sounds moist.
Very moist.
And one breath sound that's described as being moist or crackles.
Exactly.
So this might give it away, but what if I told you this patient was presenting with pain in one place of their chest?
Pleurisy? No.
Effusion?
Plural rub.
That was plural rub. Do it again.
Okay.
I can hear it now. It doesn't.
I know what a plural rub is, sir. I've never listened to
getting really defensive over there, Daniel.
Wrong guy. Pleural rub. And so for you listeners, is this something that they really need to know? I just want to know. Is this something that I missed out on 30 years?
I mean, here's my take on that.
Okay,
I feel like all of the 20 plus year vets that I know, when they don't know something, they go, "Why is it going to change the way that I treat the patient?" And it's like, well, I don't know. Like, we should just know these things.
All right.
Sometimes it's good to be aware of
What you don't know.
Yeah. And if someone's complaining of chest pain and you hear that, you might think, okay, well, I'm not going to go down the cardiac chest pain route with my treatment. I'm just going to go with the pleural rub treatment, and they probably need to go to the doc and get some antibiotics or whatever else they're going to do for it. You know what I mean?
All right.
So this is the patient that's going to present with probably healthy,
Yeah.
a little bit of chest pain when they breathe in.
Mm-hmm.
And on palpation, right?
Maybe.
Could be. Yeah.
Maybe.
Make me look good.
Yes.
Yes, Dan, absolutely.
Yeah.
It's a sharp pain in nature.
Yeah. Mm-hmm.
Increases with palpation respiration.
They're going to be kind of,
Guarding.
guarding it a little bit. Yeah.
Now I know. Okay.
Yeah.
All right, give me number 3. This one's definitely not going to be a wrong guy.
All right. Let me find the definition here of pleural rub. Stand by. Okay. So book definition, pleural friction rubs. Grating sounds that occur when the pleural linings rub together. If this occurs, the pleural layers have lost their lubrication, most commonly caused by inflammation of the pleura. This condition is usually associated with pain on inspiration. The sounds may be heard anytime the chest wall moves, therefore they can be heard on inspiration, expiration, or both.
Wow.
Pleural rubs.
Pleural rubs. Thank you.
All right. So nobody got that one.
No puntos.
Still 1-0.
1-0.
I still have a
Always in the lead.
chance.
You still
I
got a chance,
I
man.
have a chance.
6 more.
One of those has to be a wrong guy.
6 more.
We'll see. All right. Here is lung sound number 3.
Rails.
I'm going to say, sorry.
Go ahead, because that was my final answer, so let's see what you got.
I know that pneumonia is not an answer, but crackles. Is that an option? Is crackles an option?
Well, with all due respect, 5-star and CFRN, rails and crackles are the same thing, yes?
They're both described as wet lung
Wet
sound.
and moist.
Moist.
So, Daniel,
Yes.
that is correct.
Yes.
Ooh,
Woo.
1-1.
Yes. So, you guys are technically both correct. She added
he
some
got it right
detail to the
first.
answer,
Okay.
but he got it right first.
Thank you.
And crackles, rails, very similar.
You don't have
Wet.
to say moist.
Wet lung sounds. Let's just read the definition, Steve. Okay. Wet breath sounds may indicate cardiac failure or infection, especially in a very young child. Rails are often difficult to hear, especially in the back of a moving ambulance. A moist crackling, usually on inspiration and expiration, is called crackles. Rails and crackles are produced by oxygen passing through moisture in the bronchoalveolar system or by closed alveoli opening abruptly. Thus the crackling sound. So, would you describe, let's listen to it one more time. Would you describe it, because there's 2 types.
Right.
There's coarse and fine. Describe it as coarse or fine. You guys tell me.
Okay.
No cheating, Daniel.
It's very coarse.
I would say coarse, just by this recording. They sound a little different than real life.
Good. It is coarse. So, let's compare that to fine crackles.
Yes.
I always think of it as like big bubbles or little bubbles,
Yeah.
you know?
So this is
This is like the sandpaper, like finer stuff.
so of the 3 we've done,
Yeah.
this is definitely one they have to know.
Yes.
Easy treatment.
Yeah. And Dan, what are you going to do if you've got a patient with quite the history and you hear that on auscultation?
Obviously, first depends on the vital signs.
Yeah.
Want to get that nitrotrab or spray underneath their tongue as soon as I can.
Mhm.
CPAP, BiPAP.
So what's nitro going to do for someone with wet lung sounds like that?
It's going to decrease the preload.
Okay.
And so if you have pulmonary edema, low blood pressure, that's cardiogenic shock. So you're going to go with your Levophed, dopamine, epi. If it's over like 160 with pulmonary edema, then you're going to go down your scape and maybe some push dose nitro along with your CPAP bi-level.
You guys have BiPAP on your ventilators?
Yes.
Yeah. Pretty awesome.
Those
are relatively new to our department in the last couple of years.
Yeah.
They're really, really cool.
It is cool, but I mean, if you're thinking of these kind of people, if they have low sats and oxygenation is your problem, CPAP is probably the best way to go.
Yeah.
BiPAP is great for ventilation, but especially in these emergent CHFers.
Yep.
And it's easier to put on, I think.
Yep. The thing that's nice about having the BiPAP setting is we can, when we get to the hospital, if RT wants to put them on BiPAP and we have them on CPAP currently, they can give us all the, recommended starting levels that they want them at, and then we can put them on that while they're getting their big old machine ready to go. And especially if they haven't had time to set up, it's always nice.
Just for 1 sec on treatment for that one, because it's pretty easy to confuse. Is it pneumonia? Is it CHF? So like you said, sometimes they sound the same. Usually pneumonia is one-sided. CHF is both sides.
Correct.
But get a good history.
History is key on that. And then, I'm trying to think of all the case reviews I've heard where pneumonia was found to be the actual, issue going on, but we treated it as something else. You can mess people up.
Yeah.
Yeah.
Do you have in your protocols down here escape protocol?
No, we do not.
That is sympathetic crashing acute pulmonary edema. We just got this last year, and it is a game changer.
So can you explain that for listeners, what SCAPE is?
Sure.
Thanks. And this is coming from Scott Weingart's mcrit.org website. It looks like it was posted in April of 2009. To boil it down to 10 seconds, start patient on non-invasive ventilation with a PEEP of 6 to 8, quickly titrate to a PEEP of 10 to 12. Start the patient on a nitro drip, administer a loading dose of 400 mics per minute for 2 minutes, which is 120 mils per hour on the pump for 2 minutes with the standard nitro concentration of 200 mics per mil. And then drop the dose to 100 mics per minute and titrate it up from there as needed. By 10 minutes, your patient should be out of the water. No pun intended. I like that.
Yeah.
So you guys have something like that in your fire department's protocols?
Right. And it's just push dose because only our medic units have
you guys don't carry
IV pumps. So we'll just do push dose.
Okay.
Nitro.
Do you carry nitro drips on your? Do you guys do nitro drips?
We can make nitro drips on the pump.
Cool. Awesome. All right. So that was technically I gave you 2 on that one: fine crackles and coarse crackles.
So I got 2 points?
No.
Oh.
No. I gave you 2 lung sounds, so there's going to be 7 now instead of 8.
So I didn't get 2 points.
No, you got 1 point. So it's tied.
I did say it was coarse.
You did. I mean, you did after I asked. No, she said definitely coarse is what Holly said.
I agreed with you.
Yeah.
Sorry, Holly's trying to sell you out.
Thanks a lot.
I think it's
interesting
you guys are tied up right now. We'll see
wow.
We are?
Yeah, it's 1-1.
You're surprised, Holly?
I don't know.
Holly was like, I didn't even really realize I was taking a quiz today, but I guess I'll, pay attention now and turn it up.
Wow. I was there studying all that long.
Okay. Next one. Here we go.
Okay.
Ready?
Wheezes.
Strider?
Oh, Holly gets it. Wow.
But
Let's talk about it here in a second. This is a scary one. This one makes me pucker quite a bit.
however, sometimes croup sounds like that too. And croup is it is an upper airway problem, but it's not that typical stridor.
I prematured myself again. Thank you, Holly.
All right. Book definition, again, from the AAOS textbook. Stridor is a brassy, crowing sound, often heard without a stethoscope, which is very true. It is caused by the narrowing, swelling, or obstruction of the upper airway and may indicate that the patient has an airway obstruction in the neck or upper part of the chest. It is most prominent on inspiration. Stridor may be caused by bacterial epiglottitis, viral croup, swelling from upper airway burns, or a partial foreign body airway obstruction. Stridor often indicates a life-threatening problem, especially in children. Onset of crowing or stridor in the presence of fever or upper respiratory infection should be recognized as a potential threat to life. Scary patients.
Scary.
Yep. I don't like those ones.
So
There's always, you're in the middle of trying to get the story, what's going on, but your patient's so critical and you're trying to get the right thing set up for them. And it's a time-sensitive call for sure.
So what is the right treatment?
Depends on what you're dealing with.
Well,
I mean, if you got an upper airway obstruction, you've got to clear that out, right?
Understood, sir.
Joking. But if you've got a respiratory infection going on, what are we going to do for that? Yeah. Supportive care and
you can always start with bronchodilators, racemic epi, depending on what your history is.
Thank you, Holly.
Yeah.
If you have,
I was asking you, sir.
You were at. Oh, okay. I mean, yeah, we're going to do supportive care. We're going to give them some neb treatments and get them to the hospital quick so they can get the
and kids are amazingly resilient, even though it is an emergency. You can have those kids that get croup in the middle of the night and it's been hours. Put them in the steamy shower or take them outside.
Yeah.
And they can get better, but they are resilient. So don't panic. As long as their SATs are okay, they're going to keep doing what they have to do. Just try not to get them
And we say this on every episode, at least in the show notes, but always follow your local protocols. And
always.
Not anything you heard on this show, that's for darn sure. Whew. Glad we got that out of the way.
Especially the edits.
Yeah.
If you guys only knew about the edits.
Oh, my goodness. Okay, so it's 2-1.
Okay, I got that.
Yeah.
Understood.
So Holly's in the lead.
2-2 because I had course and...
No, you didn't. All right. So that was number 3.
Yes,
You're losing.
I'm losing.
Okay. You ready for number 4?
Yes.
Okay.
This is your chance to catch up.
Thanks, Holly. Wheezes. Expiratory wheezes. Epi, bronchodilators. Sleep withdrawal. Move on.
Next. So Dan knocked that one out of the park. This is expiratory wheezing. And Dan, you were throwing like 15 different treatment modalities at it. Go for it. What are you going to do for that?
Well, it depends on age. You can go.
Let's say they're 70 years old.
70?
Yeah.
Oh, I want to be careful with the epi then. So I'm going to do bronchodilators.
Okay.
Atrovent. CPAP if it doesn't get better.
Okay.
Solumedrol.
Mm-hmm.
Hugs.
Hugs. Yeah.
Holding hands works for that age group.
Yes.
Mm-hmm. Yeah. All right.
All right, so
it's tied up.
Yes.
This is, and I'll be honest, I'm looking at Holly as these things come in and she lights up like, I know it, but then she looks at you like, oh, okay, I'll give Dan a chance.
I'm not going to answer the Raoul's question. That's all you. Was that the one you kept saying? Or Ronca? Ronca.
Okay. I don't think I'll get it now. I think I've really shot my load because this is... I don't know the rest of these.
The next one could be inspiratory or expiratory.
Oh, wait, if we could do diminished lung sounds, that'd be good.
I'm good at those. Yeah. Everybody has diminished lung sounds in the bases.
Yes.
Here we go. So, okay. 2-2, tied up.
Okay.
Number 5, coming at you. Okay.
Okay. Just turned away from me like.
I'm not even going to address that one.
I don't know. It doesn't sound weird.
So.
Normal breath sounds?
Yes.
Are you feeding her right now?
No, I wouldn't feed her.
We already did bronchial breath sounds, so it must be vesicular
yes.
breath sounds.
How could you not get that?
Because it's horrible audio, sir. You want the truth.
Okay, hang on. I'll give it to you again.
Same thing.
If you heard this in the back of an ambulance, you would be incredibly enthused that you had such great audio quality.
And that you can hear.
Yeah.
Yeah, that's...
Wow.
All right. Okay. So 3-2. I got it.
Are you rushing this?
No, Holly's...
I got to give the recap.
She's obviously...
Vesicular breath sounds.
It's the way I grew up. It's totally fine.
We're all middle child
We're all middle children. Yes. We've all been overlooked our entire lives.
Yeah. So vesicular breath sounds. And if we look at the definition of that one, the finer and somewhat fainter breath sounds noted in the lateral wall of the chest are from the smaller bronchioles and alveoli, known as vesicular sounds.
Never heard
So
of
normal
that.
breath sounds, auscultated usually on the lateral wall.
We should talk about where to listen to lung sounds.
Yeah, we've actually got, I'll put a link to it. I have a video of educational video we made where we put tape on the chest to show
I was
where.
in that one.
Oh, yeah.
Oh, wait, yeah, you were.
Is it your chest?
Wait, we did one with Brian.
Oh,
That was the one I was thinking, but
so
we did one too with you, right? For
Yeah.
EMT class? Yeah. I'll put a link to both maybe so Dan feels included. You are losing right now, though, just so you know.
Your comments are appreciated.
Okay, 3-2 to recap.
So we
Dan's
only have
losing.
2 left.
We haven't done Ronkai.
Wait a minute.
We should tie.
No, this is the last one because we gave 2 crackles. So we've done 6 breath sounds, but we've only had 5 for points. Last one.
This has to
Okay.
be wrong guy.
It's going to be.
I don't know.
Come on, someone throw it out.
I mean, it does sound like something from an alien movie.
Yeah, it does.
What do you think, Dan?
All
Is
I
it?
have left is Ronkai.
Holly?
I don't know. I think it sounds more like a empty chest cavity, maybe like a deferred breath sound or something.
Daniel? It's Ronkai. Listen to you excited.
We're tied.
So, Ronkai, the definition of Ronkai, congested breath sounds are continuous with a lower pitch and a rattling quality, which you could hear at the bottom of that one, and are indicative of fluid in the larger airways in the lungs. They may indicate the presence of mucus in the lungs, for example, for the presence of an infection or inflammation. And expect to hear low-pitched, noisy sounds that are most prominent on expiration. The patient often reports a productive cough, sometimes feeling like they could be drowning. Interesting, huh?
Very.
So, I can't believe this happened. It's 3-3.
You had your money on Holly the whole time.
Yeah.
And I know she gave me a couple of those.
And guess what? There's no tiebreaker because
There is. Yeah.
Okay.
I've actually got a tiebreaker.
Oh, okay.
jeez.
All right.
So, we said this is the question. Normal breath sounds. There was 2 qualities that Holly got both correct.
Which I've never heard of.
Right.
Vesticular and
That's because it's not in our drop-down menu in the charting system.
correct.
Okay. Bronchial breath sounds
Okay.
and vesicular breath sounds,
Okay.
depending on the area of the lung that you're listening to.
Lateral lung.
Yeah. Lateral wall for vesicular.
Uh-huh.
And the bronchial breath sounds are going to be heard mid-clavicular line. But the question I have for you is, what would be the term for abnormal breath sounds? Just generally speaking.
Abnormal breath sounds?
Yeah.
Generally speaking.
Yep. These are abnormal. These are blah breath sounds.
Fucked up.
Bad.
Medical terms, not
sorry.
street slang. Might have to find another tiebreaker.
I don't know.
I'm going to say the word and you're going to be like, oh my gosh. Yeah.
Go ahead.
You guys giving up?
Abby normal? Our audience is way too young. to have seen-
Adventitious.
Oh, that sounds good. Like an adventure.
Yeah, the lung sounds are adventitious. They're abnormal.
I've never
That
heard
sounds
that word.
positive to me.
Yeah,
if
me
mine
too.
are adventitious, I'd be like, yes.
So-
Well, thank you.
Adventitious sounds include rails, in parentheses, crackles, Ronchi, stridor, wheezing, and pleural rubs.
Wow.
Yeah.
Adventitious.
Okay, now I
How
got
about this? How about we go at us? We both did super amazing. We both get a treat. We both get a coffee.
That's very millennial of you.
He's got millennials.
Yeah.
He's
You
raising
raised him.
millennials.
Yeah.
That's your fault. Okay. Well, Should we just leave it at 3-3?
Yes.
There's got to be a tiebreaker in there somewhere.
Double jeopardy.
Yeah, let me find one.
Okay.
Oh, here we go.
We'll do this, and then I've got a case review, and then we'll...
So you look
We'll
for
call it
that.
good.
And then I'm going to just do my little soapbox on lung sounds.
Yeah.
I remember being a very young paramedic, and I was working with a very gruff older guy. And I was working in downtown, and we went on a trauma patient. And I was super intimidated by this guy. And I couldn't figure out the lung sounds. I knew there was okay over here, but I couldn't figure out what was like on the right side. And I said, they're normal. So we crossed the bridge as the blood pressure plummets, and the patient goes into cardiac arrest, secondary to attention pneumothorax.
Okay.
So if you don't know what it is, ask someone. Say, I don't know what this is. Can you listen? I do that all the time now.
Mm-hmm.
I'll give the stethoscope to someone else. And,
Yeah.
Is this the wrong guy, or is this the pleural rub? So that's just all I have.
I like it. Putting the wrong in wrong guy. That was probably the best line of the entire episode. No, but I think that's really good. And you have a lot of paramedic interns
Yes.
throughout the year, and you're one of the people that does a lot of field training. And so I think it's important to know we're there as a team. This isn't a one-person show.
Right.
Lean on each other for everybody's strengths, and absolutely. Still looking up this question, by the way.
Okay. Holly, what do you got for tidbits for these juniors?
Tidbits. Just what you said. Take your time and listen to them, and actually listen in the right locations.
And listen to them all the time.
Yeah.
Because if you know what good lung sounds sound like, listen on every patient.
Right.
Because it takes, and that's what I did not do.
Mm-hmm.
It just takes reps.
Yep.
Oh, this one does not sound like the last one. What is it?
And if you don't hear anything, yeah, like you said, don't say they're normal.
Right. Check your stethoscope. I've done that a few times.
Make sure your stethoscope's turned the right way.
Right.
But clear breath sounds, absent breath sounds. I mean, when I'm trying to figure out what's going on, those things are really important, more than like, is it vesicular or, whatever. But just make sure you're being methodical about it and listening to all the... When we're in the helicopter, we can't
We can't do it.
can't hear
so
them.
we always... That's part of the quick
Yep.
1 minute assessment if someone gets breath sounds, because we won't be able to get them in the...
Okay. Tiebreaker question.
Okay.
Oh, I thought we were going out as both winners.
No.
No.
Okay, someone's got to be a loser.
Someone has to be a winner.
Stupid.
So, okay. The question is, name the 4 side effects of albuterol.
Tachycardia. Hypertension. Why do you keep looking at her?
Because she's not responding. She's
Okay.
looking at
Well,
you.
Go ahead.
I'm waiting. Go ahead.
Maybe let's do ties. Get 2 of them.
Okay.
Go ahead.
Well, you just said the easiest too.
You're smarter than I am.
um,
So we got tachycardia. We have hypertension. Side effect.
I don't know.
Seizure, coma, death? No.
Nope.
No. Let me think about it. I mean, you can get rebound. What's the word I'm looking for? Bronchial constriction.
Bronchoconstriction.
Mm-hmm.
The 4 most common.
So it's a sympathomimetic.
Mm-hmm.
So what else do we get with that?
Dilated pupils.
Oh, dilated pupils. There's one.
Nope.
Right? No.
I don't know.
Anxiety
Oh, that's...
and palpitation.
Doesn't that go along with tachycardia?
That's what I thought, but
It does, but separately.
okay, so I didn't win that one either.
Neither did I.
Okay, maybe a 4-part question isn't the right way to go.
How about we arm wrestle? She'll beat me on that one. Let's not arm wrestle.
On the topic of breathing pattern, okay?
Oh, ooh.
Shin Stokes.
Koosmalls.
Ataxic.
Respiratory pattern would be noted by the following characteristics. The rapid, irregular respirations with periods of apnea.
Good.
That is Jane Stokes.
No.
No.
Daniel?
Oh, flustered. I have a minute to think about this.
Deep.
Irregular.
Irregular. With
Nope.
periods of apnea.
Rapid, irregular
Oh.
respirations with periods of apnea.
Isn't that ataxic? Is that the right word?
Daniel, you just won the entire quiz.
Dun, 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 dun. Tell us the Cheyne-Stokes definition.
Yeah.
Cheyne-Stokes definition. A rhythmic breathing pattern characterized by periods of rapid and slow respirations alternating with periods of apnea, commonly seen in patients with a head injury.
What's the difference? Deep?
So the one I was going to quiz you on was central neurogenic hyperventilation,
That one.
which is
Ooh.
deep, rapid respirations seen in patients with head injuries.
We have seen that.
Yep.
Faux show.
It's that one's scary. Seen it on a motorcycle wreck. Okay, Daniel, I sold you short. You came through in the end.
You get a treat.
All right, so I gotta give you a quick case review. You guys can throw some questions my way, and then we'll call it good on this one.
Okay.
So I've got an intern during this, 2-person medic unit, fire-based DMS. Trying to think of all the other stuff I should tell people. 2 paramedics on the ambulance, and then a paramedic student. We're sent to an unknown problem, is the call. Dispatch updates us en route and says, you got a 45-ish-year-old lady. We're talking to her, don't really know what's going on. She was kind of complaining of some discomfort, and then the line went dead.
So private residence?
Yep, we're going to a private residence.
Urban, rural?
Urban. Yeah,
Okay.
definitely urban.
And you were saying it's the engine crew?
Nope, just us on
Ambulance,
the
okay.
ambulance. Yep, 2-person crew with a student.
Okay.
So we show up and knocking on the door. No response. So we're kind of peeking in the windows, going, what's going on? Well, thinking we might have to break into this thing, but try before you pry.
Right.
Are you kind of excited
And
to kick a door in?
Kind of.
Yeah.
But then the door was unlocked. So
You're kind of tall to kick one anyway.
yeah, no, they don't let me usually do it.
Yeah.
Go inside, and I would say it's probably a 1,500 square foot home, single story. You walk right into the living room, kitchen to the left, hallway to your right. Patient is in the kitchen, leaned over a table, and she is completely silent.
So standing or sitting?
She's leaned over the table.
She's leaned over the table.
Yep, standing up. And she's doing the universal choking sign. And she looks like
hands
crap.
at the neck.
Yep.
Okay.
Mm-hmm.
Wow.
Yeah.
Oh
and
my
so
gosh.
we are kind of caught off guard, like, oh, hey, this is why you couldn't answer the door. This is why the line went dead. You are literally choking.
You're choking.
So we look at our student, and I remember telling him, hey, man, cool, Heimlich, do it. And he's kind of like, like a little bit like,
Yeah.
I got to go. Okay. Gets his bearings and then goes and does a few
Thrusts.
and nothing happens.
Nothing. Uh-oh.
She's still choking.
And she's conscious.
She's conscious.
Looking
She's
at you
looking-
with giant eyes, I'm sure.
Looking at us with giant eyes and looking like it's
I'm
getting very, very
excited.
difficult for her to move any air.
Yes.
And so the quote of the entire call goes to my buddy who I was working with. And he says, if you're going to do the Heimlich, you got to get violent with it. And he goes, get out of the way. And so he gets behind her. 2 pops, food, shoots
out.
across the room.
Oh my gosh.
And she
Thank
just
goodness.
says, oh, thank you so much. That was, oh man, I was really scared there for a minute. Walking, talking, signs of
Wow.
refusal, and we're out.
Signs of refusal.
Yep.
Oh
Yep.
my gosh. I hate choking calls.
Choking
I hate
calls
them.
suck.
Yeah.
They're scary.
I love choking calls.
You do.
Oh,
What do you mean?
Oh, I love them because you
Which
are
part?
heroic stuff.
Oh, okay. Like the hero stuff.
Yeah.
Well-
Who doesn't
So-
like that?
But so give me your algorithm. So and then I'll tell you what the majority of people,
okay, Dan, when you say my algorithm,
your choking algorithm.
as far as like, what am I going to, my treatment, go down my treatment pathway?
Right.
If they're conscious, I'm going to do Heimlich.
Okay. Excellent.
Yep. If they're unconscious, I'm going to lay them down,
Okay.
go through all my BLS, AHA stuff.
Okay.
And then
Until what?
I'm not going to wait a whole lot longer to get in there with a blade and some McGills and try and see what I can see and grab something if I can.
Okay.
And then, The other thing is, if it's deep down in there, we're just going to push it down further with the tube and intubate him, and then let the pulmonologist scope it out, because we need to ventilate.
Right.
Right.
So this is what I'm going to say. So
you obviously have an algorithm on this one.
I do.
Yeah. Okay. I love your algorithm.
So like you said, BLS.
Yeah.
Lay him down. But now we're talking just, you have a little bit of time, right? So somebody goes in, if there's no trismus, and you can open the mouth, and you start looking with that, get the blade in there, the McGill's, while the other guy is getting his shit together for the crike. Because you don't have to go through all this other stuff and then say, oh, I can't get it. He's braided down. He's in cardiac arrest. Now we'll do the crike.
Yeah.
Get ready to do that. Get all prepped and ready to go. And if you can't get it out of the mouth with what you have, he's all set. Because it takes a little bit of mental
to get your brain around the idea of doing a crike. Yep.
Right.
That's the hardest part about this,
Right.
Making the decision to do it. Yep.
Right. I remember going on one. It's actually been 21 years ago, because I went to the house just last year. Same house, same family. That
No way.
This dude died in front of, because we parked out on the street, which was a long walk. The ambulance pulled in. They didn't bring their crike kit. And we ended up working a code because we just couldn't
pull the trigger on it quick enough.
Couldn't find it. And ours was way out. By that time, he was dead.
Bummer.
So
another difficult part of choking patients is that if they're conscious and they're even moving a little bit of air, you really just need to let them try to do their thing. Don't interrupt.
Position comfort.
And so you're just sort of like, when do I intervene?
Right.
Yeah.
Have all your
Hoping
stuff
that
ready.
hoping it's going to happen. I'm glad she was conscious enough to give you that choking sign. Otherwise,
Right.
it just would have been a straight code.
Yep.
And
Who knows what would have happened from there? Mm-hmm.
Oh, yeah.
probably would have thrown a king in or something and never known.
Not even looked in there.
Mm-hmm.
I choked on quinoa once. I know that sounds so weird.
It's like the
But I had
tiniest-
the worst laryngospasm. I literally had my cell phone out and had 911
Really?
dialed because I could not breathe. But anyway, I recovered, obviously. It's my brain damage coming through.
Bummer.
But it's scary. It is so scary. And to have the wherewithal to call 911 and get someone coming.
Yeah. I remember
So scary.
the last thing I'll say on it that is in my brain when I get dispatched to choking calls or hear about them, a 35-year vet who retired in the last few years from our department said that there's very few things that he runs to the engine on to go respond to. He said choking is absolutely one of those like two calls that he will sprint to the engine because it is extremely time sensitive.
Yep.
That's a good idea because we do kind of get in our...
We dawdle.
Yeah.
Yeah. But
what's the second one? Do you remember?
Oh, man. Cardiac arrest.
Cardiac arrest.
Yeah.
Yeah.
And so those were his two. He's like, we got to get there quick. That was a podcast episode. Lung sound quiz. Dan pulling through in the end there with the
right.
with the win.
Believe that.
Holly was
I think we
nice
just-
enough to give him a few.
Yeah,
That
thank
was
you, Holly. I
so kind
appreciate
of
you.
her. All right. Well, let's leave it there.
Let's do it. You're going to leave that link to the show notes or the video where they know exactly.
Yeah.
what
So
to
in the
do?
show notes, we'll have a link to the lung sound video and a couple of we also have a video on our lung sounds that you can kind of see a slide that has the title of the lung sound and then it plays the audio of it. So
Perfect.
yeah.
Cool.
All right. Thanks everybody. We'll leave it there.